I would like to start by giving you some information on Connecticut's flagship public institution of higher learning. UConn is classified by the Carnegie Foundation as a research-intensive university, a prestigious designation shared by only the nation's top higher education institutions. Research at UConn ranges from improving human health and reforming public education to protecting natural resources, with many other specialized research areas. Research is pursued at more than 70 dedicated UConn centers, where faculty members and graduate students work collaboratively to discover new knowledge and to create practical solutions. 10 UConn schools and colleges make our main campus at Storrs, Connecticut their home. The schools of law and social work are centered in Hartford, Connecticut, and the renowned UConn Health Center, including the schools of medicine and dental medicine, is located on a 205-acre campus in Farmington, Connecticut. The University of Connecticut features state-of-the-art pedagogical facilities on its central and 5 regional campuses, which together span over 4,100 acres. When making the decision on where to earn your graduate degree, a number of questions come to mind, and one of these is, what does the school to which I'm applying for offer me? By joining our School of Nursing, you will receive a number of benefits, including the ability to access, evaluate, and incorporate new practice standards and approaches from nursing and related disciplines. Build your foundation of scientific and ethical acumen to enhance clinical practice and administration competencies at all advanced practice nursing levels. Contribute to team efforts that develop, implement, and disseminate research findings to strengthen evidence-based nursing practice. Master information systems technologies that can influence outcomes through quality improvement processes. And collaborate with healthcare teams devoted to health promotion, risk reduction, and disease prevention. Now that you've seen what the school has to offer, let's look at why you should choose UConn's nursing graduate program. The school has been graduating PhD students for 12 years with an impressive track record. We have one of the shortest times to graduation among all doctoral programs on campus, and over 90% of our students have completed their doctoral degree once enrolled. Our fully accredited program allows you to complete your degree in 3 years depending on your course load. We are the only National League for Nursing Center of Excellence in New England. Our faculty members develop outstanding mentoring relationships. We have strong links with community-based healthcare resources, including our renowned UConn Health Center. You can personalize your own program of study. Listen to what some of our students have said about our doctoral programs. Paula McCulley, a Doctor of Nursing Practice graduate, shares her experience. UConn's new DNP program is the ideal doctoral opportunity for an APRN like me, who thrives in clinical practice, serving patients, families, and professional teams. I'm deeply concerned professionally and personally about the uncertain future for clinical environments, so I've committed myself to helping assure that tomorrow's clinical settings are populated with competent, confident, compassionate professionals. This program hones every leadership tool in my skill set to help support that goal, while it protects the privilege of a doctorally prepared nurse to continue to practice at the bedside. Maura Shea, one of our PhD students, recommends this program because it is a privilege to learn from the noted scholars in nursing at UConn. The professors at the PhD program are extremely supportive of student learning and research efforts. My student peers have come from Connecticut, surrounding states, and other countries, and our work together has enhanced my PhD journey. I have learned more than I ever thought possible about the philosophy of nursing science, theory, and research methods. A number of components will ensure your successful graduate experience at UConn: passion, support, colleagues, self-satisfaction, and the relationship with your major and associate advisors. You will embrace your education with us, achieve your goals, and be prepared to lead as you complete your degree requirements. This is also a time for personal growth. Most people don't return for a graduate degree unless they really want it. They have a strong desire to further their education. At this time, you need to examine what it is that you really want to achieve. It is a time to discern the research interest that is going to excite you, that you can be passionate about, and even better, that can meet a significant social need and can help sustain a lifelong program of research and practice. So look at this as an opportunity to enmesh yourself in something that's going to excite and interest you for the rest of your nursing career. Now that you've decided to embrace your education, it is important to talk to your family and friends while you arrange time to immerse yourself in your studies. Support from your family is crucial to success within our academic programs. Be proactive and make the arrangements you need to study, research, and learn at your own pace. Student colleagues are a crucial part of the graduate program experience. You learn as much from your colleagues as you learn from the classroom setting. We create numerous opportunities for interaction among our students. Other students in your program will act as a valuable support group as you challenge and stimulate each other in the class setting. The Packard Doctoral Reading Lounge is available on the third floor of Storrs Hall for collaboration and sharing knowledge. This is a place where you can relax while on campus. Our brown bag luncheon, guest speakers, and doctoral seminars are just a few of the activities that are scheduled for our doctoral students. With all of this in mind, don't forget to enjoy your colleagues, faculty, and the wealth of information you will obtain from our program. We want you to have fun and also grow as a person. This growth is what will develop you into an expert and a leader in nursing healthcare. Once you are admitted into the program, you will be assigned a major advisor. For the PhD program, upon your admission, you will be assigned a research mentor. For the DNP program, it's a leadership mentor. For the master's program, it's a track-specific advisor. Your advisor is there to meet your needs and to maintain your focus on the skills you want to develop. You will build a wonderful relationship with your mentor throughout your experience at UConn. Our graduate students have remarked that one of the outstanding things about a UConn education is the quality of experience they received from their mentor relationship. We make every effort to fulfill your needs. For the doctoral programs, to round out your support team, you will have 2 associate advisors. Together, you and your major advisor will select your associate advisors based on content expertise and method expertise. These teams will help you with your dissertation, research, and learning during your time in the PhD and DNP programs. We prepare you to lead whatever direction you choose to take. As a PhD student, you may examine the premises, purposes, and epistemological development of science, or develop nursing theory, or test nursing phenomena, or investigate practice-based questions, or develop and use research methods, or design and validate instruments. Enrolled in the DNP program, you can learn to advance current healthcare knowledge through practice-based research, develop cultural awareness while working with a diverse population, and develop skills to implement and evaluate healthcare policies. In our master's program, you can lead by synthesizing appropriate theories from nursing and related fields to respond to emerging healthcare challenges, demonstrating praxis as an advanced practice nurse in a selected area of nursing specialization, influencing healthcare policy for the benefit of person, community, nursing, and environment, exerting leadership in creating a collaborative and caring healthcare community, and conducting evaluative research and apply research findings to creatively respond to healthcare challenges. Now for some information about our Doctor of Nursing Practice program. The DNP program is designed for those who want a terminal degree focused on the science of clinical scholarship. It is the highest level degree that one can earn as a clinical professional. And the exciting part is that, throughout the curriculum, DNP-prepared nurses have the ability to partner with PhD-prepared nurses to fully implement the research that's resulting from those who have returned to school to develop nursing science. The DNP program is based on the guidelines of the American Association of Colleges of Nursing, which require specific practice areas or competencies built into our courses. For example, the Scientific Underpinnings course looks at the theories from nursing and other disciplines. The Organizational Systems and Healthcare Policy Leadership course provides a foundation of scientific and ethical knowledge for nurses to develop areas of expertise in clinical practice and administration. Our evidence-based practice course focuses on the implementation and dissemination of the research that supports the practice that is happening in the clinical arena. We also have a course on impacting healthcare through informational systems and patient care, which focuses on information systems technology, electronic medical records, and improvements to the quality care through technology. And finally, there's an interprofessional collaboration course that examines enhancing health promotion, risk reduction, and illness prevention. It is all here, waiting to help you emerge as a clinical scholar. In November of 2011, the UConn School of Nursing implemented its post-BS DNP program, offering an opportunity for students with bachelor's degrees to enroll in the DNP program. Go to nursing.uconn.edu for more information and to see if you qualify for the program. In our PhD program, you will apply nursing science philosophy, analysis, and theory development, refine your knowledge of nursing research ethics, quantitative and qualitative statistics, instrument development, and internships. Undertake courses supportive of your dissertation area that meet university language requirement. And research and defend your dissertation. The minimum number of credits beyond the master's degree is 56 credit hours. UConn offers PhD research internships, which will provide you with hands-on research experience with a research mentor. Graduate assistant positions are also available by application to full-time graduate students. Teaching assignments are available in the clinical and simulated laboratories theory lecture courses, or as a teaching assistant to a full-time faculty member. Research assignments can be in the Center for Nursing Scholarship or in support of master's and PhD faculty research. Interested students must be available for an interview with a prospective supervisor. Appointment is based on academic merit and expertise and skills required of the position. Continuing appointment is dependent on satisfactory performance. Alternatives include a paid GA on faculty research grant, unpaid GA on a faculty research grant, work with a national expert at another university, or work with a UConn faculty member on research. The residency requirement for PhD students is 2 consecutive semesters of full-time study. This requirement can be fulfilled in one of 3 ways: 9 credit or more course load per semester, 6 credit or more course load plus a GA position, or enrollment in dissertation credits, 6 to 9 dependent on GA. Our master's program allows you to specialize in one of 5 advanced practice programs which facilitate specialized knowledge, skills, and values. They allow you to assume leadership roles within the healthcare system. The advanced practice programs offered include Adult Gero-Acute in Primary Care, Family Nurse Practitioner, Neonatal Nurse Practitioner, and Clinical Nurse Leader. Also available are Postmaster's Certificate in Adult Gero-Acute or Primary Care and Neonatal Nurse Practitioner programs. The Clinical Nurse Leader program prepares individuals to coordinate care throughout the healthcare delivery system. Clinical nurse leaders complete their core graduate courses in health assessment, pharmacology, and pathophysiology. Graduates of the program are eligible for national board certification. The Adult Gero Nurse Practitioner in Acute Care prepares graduates to assess, diagnose, monitor, treat, and coordinate care for acutely and critically ill adult individuals. Graduates of the program are eligible for certification through the American Nurses Credentialing Center and American Association of Colleges of Nursing. The Adult Gero Nurse Practitioner Primary Care track prepares graduates to assess, diagnose, monitor, treat, and coordinate care of individuals with common acute and chronic conditions. They are trained to focus on health promotion and disease prevention to support healthy lives. Graduates of the program are eligible for certification through the American Nurses Credentialing Center or American Association of Nurse Practitioners. The Family Nurse Practitioner track, a primary care program, prepares graduates to assess, diagnose, and monitor health and illness across the lifespan. They care for children and families as they age and grow. Upon graduation, students are able to attain certification from the American Nurses Credentialing Center. The Neonatal Nurse Practitioner track allows graduates to become neonatal clinical nurse specialist or nurse practitioners. They are eligible to take the Neonatal Nurse Practitioner exam upon graduation. Let's discuss the general DNP admission requirements. The level of entry can be from either post-baccalaureate or post-master's. You must have earned both a bachelor's and/or a master's degree in nursing from an accredited college or university. For the postmaster's program, you must have a National Advanced Practice certification in your area of specialty. Either entry requires a cumulative GPA of 3.0 or higher from your previous program. In addition to their course load, DNP students are required to accumulate 1,000 hours of clinical post-BS with a minimum of 250 hours clinical practicum tied to clinical practice dissertation. For the postmaster's student, the hours attained in the prior APRN program will be applied to the 1,000 hours. The general PhD program admission requirements include a bachelor's or master's degree in nursing from an accredited college or university, a master's level statistics course equivalent to educational psychology 5605 or nursing 5020, and a cumulative GPA of 3.25 and GRE official scores. Consideration for admission to the School of Nursing Master's Program requires that you have an earned bachelor's degree in nursing from an accredited college or university, a cumulative GPA of 3.0 or higher, 3 letters of recommendation, a current CPR standing, and an active nursing license. Financial assistance is available for students by need and by merit. The Federal Nurse Traineeship gives financial support on a semester basis to eligible students. Students who earn positions as graduate assistants receive a tuition waiver, not including fees, and a biweekly stipend. Graduate assistants may purchase healthcare coverage, heavily subsidized by UConn. For more information on GA benefits, please visit the University of Connecticut's Human Resources webpage. The university also offers scholarships and financial aid opportunities to those who qualify. In addition, the New England Regional Student Programs offer special tuition rates to out-of-state students. Finally, the School of Nursing offers many scholarships that can be viewed and applied for on our website. Check the graduate catalog and the School of Nursing website for more information. The School of Nursing accepts applications under rolling admission. Applications are encouraged by February 1st for all doctoral programs. Applications for fall semester must be received by May 1st for consideration for the fall semester. Admissions are accepted for fall semester only. Visit grad.uconn.edu/prospective/online.html to apply. The School of Nursing also encourages applicants to submit any of the following for consideration on your application: an RN license, a copy of your CV or resume, a personal letter of application, official GRE scores for PhD applicants only, published works or scholarly papers. It is important to maintain your focus throughout your studies. Your papers and research should build on each other across semesters. Instead of writing a paper on a different topic each time, develop expertise and refine your thinking in your chosen specialization. This allows for more efficient and fulfilling learning. Set some personal goals to achieve prior to graduation in addition to your coursework. We suggest you present pilot research at conferences such as the Eastern Nursing Research Society, attempt to publish manuscripts in peer-reviewed professional journals, seeking funding to support your dissertation, and prepare your portfolio requirement. By setting these goals early, you can take full advantage of your time as a graduate student. Take any opportunity to participate in nursing conferences. Submit abstracts for paper or poster presentations, attend regional and national research clinical conferences, and begin networking with your future colleagues. Because it can't be all work and no play, the school sponsors networking and socializing events throughout the year. There are scheduled lunch and lecture series, our annual research conference, holiday and end-of-the-year gatherings, and more. The campus provides a myriad of cultural and sport events. Our region offers recreational destinations from the foothills to the seaside. Nursing is a career filled with endless personal and professional rewards. As you look to your future, we invite you to explore your career alternatives in academic teaching and research, or clinical practice. On behalf of UConn School of Nursing, I would like to wish you all the best for a wonderful and fulfilling journey in the field of nursing.